Pregnancy 101 Part 6. We are still talking about misperceptions, about miscarriage, and still highlighting some things from this article that's back here on the green screen. So one of the things that the article talks about is that people also misunderstand the causes of miscarriage. We tend to assume that the person did something to make it happen. At least half of women experiencing miscarriage never learn a specific reason for their loss. Even people who are diagnosed with recurrent pregnancy loss, people who've had, it could be 2 to 3, often three miscarriages, they often lack a specific medical diagnosis or known cause. Now, out of the known causes that are there, there's a bunch, including uterine structural abnormalities. Not everybody has the same shape of the uterus. There is sort of that typical optimal shape that's shown in textbooks. But one thing about the uterus is it forms in two pieces. When the person who eventually, the adult with the uterus, back when they were a fetus and they were developing, you had two parts that had to come together and fuse. Well, for some people, those parts didn't fuse optimally. Some people have a septum, kind of like a wall down their uterus that can cause problems with implantation. So these are some of the things that can cause problems, and it's not anything that's the fault of the person who is pregnant. Now, some other things that are very common are what we call chromosomal abnormalities. This is when instead of having your typical 46 chromosomes in the nucleus of a cell, you have some other number. And this often happens because of issues with meiosis. Back when the sperm or the ovum were being formed, things were not distributed properly. And so you don't have that typical number of chromosomes. Some chromosomal abnormalities lead to conditions that are compatible with life, but they lead to certain symptoms, like you might be familiar with Down syndrome or some other chromosomal abnormalities. A lot of chromosomal abnormalities are not compatible with life. Not having those right chromosomes in the right locations means that the development can't continue. So that's a very common cause. Again, that's not something that's the fault of the pregnant person. That is just something that happened because the process is complicated. It's a highly complicated process. Lots of stuff can go wrong. Now, there are other causes of miscarriage that we need to talk about in the next part.